Assalamualaikum doctors. In this video I am discussing daytime enuresis. So how can we take the history of daytime enuresis or bed waiting? The exam scenario is like that. 4 years girl with concern about daytime enuresis in the afternoon after coming back from the school. So okay. So history, first of all, onset, course and durations. Is it first time occur or not? Does she get herself wet at night? Was she controlled before or not? So how long she is suffering this problem, before she was controlled or not? What was the last time she was wet herself? Anything specific happened before this? So anything specific happened before this because of any stress, we are asking. Is there any holding maneuvers? Like example, standing in the tiptoes, crossing of the legs or squatting with the heel pressed into the perineum, straining, weak stream. So holding maneuvers. Then is there any burning sensations, itching, redness? Can she wait her turn to go to the bathroom? How frequently she pees? How frequently she drinks? Describe for me her pee amount, color, odor. Is it frothy? Okay. Any swelling in her eyes, legs or other parts of the body? Swelling of the private in boys. So is there any swelling, nephrotic syndrome we are excluding? Any abnormality in the opening of the pee in boys? Wiping technique in female, like is it from front to back or back to front? Who take care of her regarding this issue? Anyone measure her blood sugars? Anyone measure blood pressures? Any preceding flu symptoms? Is it associated with any fever? Analysis if present. What did you do for that? So again I am the chief complaints has history present illness telling. It is very important. Then as usual other structures. So first of all, when started onset, how long suffering these conditions? Is there anything make it better or worse? Is it first time or not? Does she get herself wet at night? Was she controlled before or not? When was the last time she wet herself? Anything specific happened before this? Holding maneuver. Examples like standing on tiptoes, crossing of the legs or squatting with heel pressed into the perineum, straining weak stream. Then is there any burning sensation? So burning, any sensation for UTI, we need to know. Itching, redness. Can she wait her turn to go to the bathroom? How frequently she pees? How frequently she drinks? Okay, how frequently she drinks? Describe for me her pee amount, color, odor. Is it frothy? Any swelling in her eyes, legs or other parts of the body? Swelling of the privates in boys? Any abnormality in the opening of the pee in boys? Wiping technique in females. Is it from front to back or back to front? Who take care of her regarding this issue? Anyone measured the blood sugar? Anyone measured her blood pressures? Any preceding flu symptoms? Is it associated with any fever? Analysis if present. What did you do for that? Then general we are asking FWSL, that is fever, weight, activity, sleep. Appetite, weight, activity, sleep. Okay. Other concerns like any dysmorphic features, any chronic illness suffering or not. Then from systemic review from GIT we are asking any tummy size, pain and its severity. Poo, describe for me, especially if constipation. Remember constipation or not, that is one of the cause. So we need to identify that. Any swelling, redness in the back passages, sore throat, lip fissured or peeled, taste loss, in chest recurrent bug, cough, dyspnea, musical sound, contact with COVID and smell lost, endocrine swelling in front of the neck, prefers hot or cold weather. Then musculoskeletal system, muscle pain, skin lumps, neck swelling, size, mobile, red, hot, painful, hair, nail, lip swelling, hand swelling, peeling of the skin of the hands or feet, bone pain, joint swelling, redness, number of the joints, affection, limitation of movements. Then CNS, was vision is affected? If it affected, then unilateral, bilateral, redness of the eye, hearing. Feeds, bug in the brain, decreased consciousness level, increased intracranial temperature, signs, abnormal movement, weakness, abnormal behavior. Your the CVS, heart racing, blood pressure, exercise intolerance, awareness of the heartbeat and pallor. Hematology, pallor, bleeding, bruising and recurrent bugs. Then past 5TIOA, 5TIOA, any trauma, traveling history, any treatment taking, blood transfusions, any surgery. These are any previous investigation, examination. These are, if anything, find, then tell that. Perinatal history as usual, puberty as usual, vaccination, receive all her shots, COVID vaccinations, allergy as usual, nutrition, number of the meals, content of meals, who prepare it for her. Development, is there any growth chart? It is normal to PR, we are asking. Family, social, we are asking who take care of her while the parents are at work. This is very important. So who take care of her while the parents are at work? I am sorry to ask about you this. Do you suspect to she exposed to abuse? So it is very important. She exposed to abuse. Then school, is it mainstream or special school? What about her performance? Attendance, any absent, bullying issue or school? So it is important, bullying issue in the school, because stress can be do that. Psychological or impact, like how does this condition affect the family? Now about the enuresis definition, if we tell that enuresis is the passage of urine without control after the age of 5 years. Remember, after the age of 5 years. This can occur in the day or night time. Daytime wetting can occur on its own or along with bedwetting. Enuresis is a stressful experience for children at any age. DD, it is important to be supported, especially when they begin to attend school. Okay, so enuresis DD, what we keep? First of all, it can be it is a case of enuresis we are telling. Then the cause may be UTI. For UTI, we are asking what? That is frequency, burning sensations, hold herpes, urgency present or desire, any tummy pain. Then UTI, abuse and NAI. So if for abuse, we are asking, is there any safety threatened in the home? A non-accidental injury, so anything we will issue. The psychological issue present or not, like last 3 months she is suffering this condition. Before, what happened? Anything like school issue, new school or friend transfer, or parent divorce occur, new place they transfer. So this is all about. These are the coming normal. The task 1 I already tell. Another task like secondary enuresis due to constipation and separation anxiety from her best friend. So that is a secondary enuresis because constipation and separation of anxiety from her best friend. Another task is that 8-year-old has intermittent daytime and nocturnal waiting. So if nothing, then it is a functional enuresis primary, and the secondary is that any stress, any cause if we identify. So this is all about history of enuresis or bed waiting in kids. Thank you.